Hello, everybody. This is day 7 of 101 Days Live, and I am going to get Mrs. Chelsea Beyers in here, Dr. Chelsea Beyers, to join us. And I see one viewer. Pardon my finger on the camera. As soon as I see Chelsea in here, I'll get her over. So, there she is. Hey, hey. And it worked right. And it's
Yay!
very late here on the East Coast and somewhat later for some people over there on the West Coast. So we'll see how many we have join us live, but the beautiful thing is people can come back. If you guys do watch it on the replay, let us know that you are here on.
Hashtag replay.
Yeah. And ask questions because this woman is full of information. So, and it's Dr. Chelsea Beyers, correct? And her patients like to call her the Vagician because she is a magician with pelvic health. She's a pelvic health expert and energy medicine practitioner. What a beautiful combination. She's the founder of Treasure Valley Pelvic Health. That's a hard word for me tonight for some
It is.
reason.
A lot of times it comes out as public health, a lot like over the phone or everything else. Yeah, it's a tough one.
Right? Yeah. And then she has an absolutely awesome group on Facebook called Feminine Healing and Pelvic Health, and it has all sorts of information all about things pelvic. So,
Nothing is TMI.
yes, I love it. So, that's just a very broad overview of who you are. Can you tell us more about you and what you do?
Yeah, so as Jessica said, I am a energy medicine practitioner and doctor of physical therapy, and I really honed in my practice in the pelvic health realm of things. So a lot of times people just don't know quite what that is. So the simplest explanation is it's all things bowel, bladder, digestive, sexual, and even I start to go into the emotional and the complex orthopedic realm of things. So a lot of times that complex low back pain, hip pain that your orthopedic therapist or even doctor can't quite get their finger on the pun intended finger on the right spot. And there's a lot of good puns in my line of work. Let me just say that. You know, there's so much more in the pelvic area that a lot of practitioners don't look at and even consider. Um, and that's what I really dive into. And, you know, I'm not afraid to have those awkward, tough conversations, but you have to do it in a way that can be authentic. It's very important that you're not just like trying to skirt around the issue. You have to be direct and ask the tough questions, but in an empathic way that you can really get the trust of the person to open up and really give us that vulnerable information, right? So
Right. Yeah,
it's
this
not
is,
normal coffee talk for most people,
yeah,
but it's
this is
everyday conversation for me.
definitely something that most people don't feel comfortable talking about. Even when it's their own body and they're going to someone who specializes in it, it's still a difficult thing to discuss. And I love that one of your big things is treating the whole human, the mind, body, and soul
For
of
sure.
people and finding that health. So, how what does that look like in treating the whole person, the mind, body, and soul? Because typically we go to a doctor and we tell them our symptoms, and it's all about treating that symptom.
Sure. So, you know, my initial evaluation is 90 minutes long for that purpose. I dive in and I ask all the seemingly insignificant um, questions, but to me, it adds an extra puzzle piece in place, right? So if I just had somebody fill out a questionnaire and intake form as far as like, what are your bowel movements like? What are your bladder habits? One, society has normalized so much of these dysfunctions to being normal, that the vast majority think that whatever is going on is within the normal realm, but it actually isn't. And for instance, like menstrual cramps, those are by and large quite common, right? I believe the statistic is like 2/3 of women have menstrual cramps to some varying degree and severity. However, to me, in my realm of work, it's a sign of tightness and dysfunction of the tissues around the uterus that doesn't allow it to contract effectively and efficiently, causing that pain and dysfunction. That can also lead to bowel problems, or bowel problems can even aggravate the cramps. So like those little connections that you think are like, well, I'm here for menstrual pain, but why are you digging so deep and trying to learn so much about the way I poop, right? So those like you have to get all those pieces together. But then even backtracking to surgeries, abdominal surgeries, even the small laparoscopic surgeries, those still have significant effects on the body and create kind of what I call kind of an anchor point, a tether through the tissue. Because even though it's small, they have to kind of weave their way through the abdominal cavity or wherever they're searching to get to the structure of interest. And that disrupts the integrity and the mobility. And as even the most delicate and gentle surgeon can be, they're still going to disrupt it and create some sort of friction or scar tissue potentially, which can then cause problems down the road. I want to know, and I don't really dig into maybe the layers of the psychological, the psychosocial component until like their second or third visit. But for instance, if I'm giving them exercises to do, which by the way, not everybody needs to do Kegels. Let me just put that out there at the forefront, because a lot of people are like, oh, it's just Kegels. And no, it's actually a whole lot more than that. But really trying to understand, what does their day look like? If I'm giving them exercises and they come back after that session of me initially issuing them those exercises and they didn't do them or whatever, I want to know the why. I want to know, did I give them too much? Were my expectations set too high for what they could kind of easily integrate into their day? Or did they not understand something? Like what was the breakdown? And let's address it from there. Maybe it's that they didn't even talk about their grandmother that they're having to take care of, and it's a big stressor and they don't have time, right? All right, well, let's talk about what your day looks like from start to finish, and easy ways to integrate in, whether it be an exercise, whether it be a breath pattern, maybe some meditation or journaling, do a brain dump, something to help find a little bit better balance. Balance is this elusive state that we all try and search for. Most of us, many of us search for. But it just, if we can help pull people away from that sympathetic overdrive that our society perpetuates, that fight, flight, or freeze state, that it's just go, 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 and getting back to a little bit more of the innate slower flow, going with the rhythm, recognizing the rhythm of a day, especially women. Our society is so male dominant and sympathetic driven that it's really hard for us to now pull back into a slower pace, that parasympathetic rest and digest. And I think study after study is coming out to support not only just mindfulness and meditation, but good like sleep hygiene. The lack of sleep, you're then functioning pretty much like an alcoholic, not alcoholic, but someone who's been drinking, and trying to drive, right? Like there's so much importance that our body really needs that slower state, and it starts to create a breakdown of the integrity of the tissues and the system, which then leads to blood pressure problems, cholesterol problems, neurological problems, and so on and so forth. So really trying to take a moment to listen. Like if I had to step back and think what the biggest skill that I have, it's listening. And I want to hear the person's story. Like what are their challenges? What are their pain points? And then, okay, here are your symptoms that are important to you that brought you in. How can we relate that back to your lifestyle? How can we modify some of your habits or improve some of your habits that will better foster a healing journey for you to eliminate those symptoms? So it's kind of a moving target, but it's a puzzle I love.
But who wouldn't want their physician to sit with them and really listen? That's been one of my most frustrating things through all the years, is just saying, you're not even hearing me. You're not listening to what's going on. So
Even the
I love
most
that.
basic thing that has come up recently is like, so you have someone who's calling, inquiring about scheduling, and then you tell your story to the front desk person to get scheduled, right? And
Mhm.
then you arrive and you see a medical assistant or a nurse and you tell your story a little bit, or at least to some degree, and they take the details. And then the doctor comes in and you rehash it again. It's like, do you guys not even flip and communicate? Like, come on.
Right,
Let's get a more efficient system and let this patient know that we're actually from start to finish listening and
right,
here to help them.
right.
So,
Yeah, yes. That's, ugh, I, I just don't even know where to go with that, because it blows my mind that to hear a health professional saying that um,
yeah, you'd think it's
is,
a novel idea.
yeah, unfortunately, there's not many that do that.
Yeah.
So, one thing that you strive to do is to help people heal so that they can live a life without limitations.
Mm-hmm.
And that living a life without limitations, listening, all of these things go beyond, because we've had quite a few guys pop in here. I don't know if they're sticking with us through this, but how does all of this tie together just to life in general?
Ooh, that's a good question. So to me, I think about when I say that I help people live a life unlimited, or without limitation, I think about how so many people, I work with primarily women in the clinic. However, I do still treat men, but and I help them live without limitation as well. They Women specifically oftentimes struggle with their activities that they want to do after having kids. They're embarrassed because they can't jump rope, they can't run, or whatever, because they experience leakage, or because of a chronic pain, a pelvic pain, oftentimes in my world and sphere, but it might be back pain, hip pain, knee pain. How can I help? Maybe not eliminate. I don't want to totally eliminate, promise that I'm going to eliminate the full symptom, but how can I eliminate the uncertainty of what their expectations are? If there isn't a need to modify, okay, we're going to have that conversation, but let's do our damnedest to try and get you back to whatever you want to do. And yeah, we might not go from A to Z and jump without going through all the other hoops and letters of the alphabet, but let's make a nice, diligent path and plan so that we can know that, okay, we've at least checked every box, that we know we've done our due diligence on all contributing or potential contributing aspects, to be able to get you back to whatever is important to you. And that's the biggest thing. My second question, I asked them, tell me about whatever whatever the front desk gathers and tells me that they're bringing in that brings them in for the day. Tell me like how this all started and so on and so forth. And after they tell me their kind of quick high level story before I dig into the details, my second question is always, what would it look like for this to be successful to you? Because to
Mm.
me, it isn't like I could fix all these boxes and or check all these boxes and fix all these problems that I can find, but that might not be relevant to the patient. And that's what really comes down to is what is relevant and important to the patient? What do they want to get back to? Like I had one gal, her biggest goal was to be able to just chase after her little in the front yard without having to worry about peeing her pants.
Yeah.
That's not too
Yeah.
much to ask for. It
No.
really isn't. So that's again listening and learning over the years to ask the right questions. And instead of it being a lot of clinics, I feel say they do patient-centric care. They make it sound that way, but I feel like if they really do that, then they turn everything back to what's important to the patient. Yeah, we have our tests and measures to show this and that, but you have to then explain that to the patient because you could spend 20 minutes looking at the mobility of the large intestine and if it's tight over here on the descending colon versus the ascending colon and getting all nerdy. I've already lost you. Like, has no relevance, right? But if
Right.
you explain, like, oh, well, it's really common on this side of your body where the descending colon is, and I'll use the anatomical side so that they can have some connection and relevance and have that like level of knowledge out there, right? Like this is super common for this area to be tight and restricted and contribute to your constipation. This is a common hang up spot. And sure enough, you're tight there. Can you feel that? Like, through the tissue. I'm like, oh, yeah, I feel that. Now let's do it again and work with it. And then they see the before and after difference. It's not just, I don't want to just prove a point, but I want to always relate it back
Mm-hmm.
to their problem or their issue that brought them in.
Well, and I've seen Chelsea work magic in person. Um, one of the gals at our retreat, so I got to go to retreat with Chelsea for Melissa Walsh's retreat this past spring, and somebody was having a hard time, like normal with travel. Sometimes your bowels don't want to function, and Chelsea sat down on the floor with her for a little bit, and next thing you know, she's moving. so so she is definitely magic in more places than the magician. Um, what's one myth about the female pelvic region that comes up often? Um,
I think the most common one is for I'll do two, one for people who have had children and one who have not had children, but they're as I'm saying that I'm like thinking like three or four or five more. The one for women who have had children is that it's normal to leak. And kind of piggybacking on that those who have had a cesarean, that they get to skirt any problems affecting the pelvic floor. And both of those are false. It's actually not normal for people to have any degree of leakage. That's a sign of weakness or some sort of dysfunction. Maybe it might be actually tightness, which can be counterintuitive if you think if something is leaking that it might be too tight.
right.
But that can be, it's so deeply ingrained in society that so many women come in like, oh, it's just normal. I just had 3 kids. Like, oh, hold the phone. That's not even what brought you in, but you can't even control yourself. If you have the urge to go to the bathroom or if you jump, laugh, sneeze, cough, whatever it might be. So that is by and large probably the most common myth that I hear. The other one that I hear, I'm gonna throw two more at you actually.
All right.
Two for one. Is, like I mentioned before, the menstrual pain, that is common again, but not normal. Those who experience it is usually a sign of some sort of restriction around the uterus or at the uterus itself. So creating better mobility so that when the uterus does contract during menstruation, that it can do so more effectively and efficiently so it doesn't hurt. When someone has such severe symptoms that kind of pushes them over into endometriosis, that gets a little bit more complex. It's a lot more tissues involved, and obviously there's adhesions and all that sort of stuff potentially. But all that said, it can still be improved. Maybe the more severe cases need more therapy, might even need surgical intervention. But I think therapy doesn't get addressed or considered frequently enough. With that too, then there's the women who haven't had kids. They think, well, I haven't had kids, so I shouldn't leak. But that doesn't necessarily, it's not A plus B equals C.
Yeah.
It can happen just purely from, poor bladder habits, from growing up. It might be trauma and emotional related. It might be stress related, so many different things. So there's so many different little fallacies, and I can name probably 10 or 15 more, but I'll keep it to those three
Yeah.
that I thought of quickly.
Right. Yeah. And if you guys, ladies especially, join the Feminine Healing and Pelvic Health group on Facebook, you'll get a lot of information, and the beautiful thing, you can ask questions. And like she said, nothing is TMI. You can go in, you can share, and it will let other people also see, if you're brave enough to share, that they're not alone in having these things, but also see that it's not normal. So,
right.
I know that you are a energy medicine practitioner, so you have your Reiki certification, right?
Yep,
Yeah.
I'm a Reiki master.
Awesome. And how does that work in with the medical realm?
Yeah, seems very like yin and yang, right?
Right.
I started down the path of Reiki, like, again, the more often that the universe brings things into my awareness, it's that tap on the shoulder, like, hey, we're trying to get you to pay attention. Go follow. Do we need to like throw it in your face? And so more and more people have been bringing up Reiki, and I'd heard of it. I knew of it kind of. I knew it was an energy thing, but I didn't really. I've always loved Mother Earth and Mother Nature and all those things, but I hadn't really like thought much about like how energy can affect our body. I knew of the chakra system, but I didn't really, I think, put much per se merit to it, if you will. And so, long story short, after gathering with some of my friends, doing a women's circle, that got brought up, and somebody mentioned this one practitioner in the area. So I went and saw her just because I wanted to experience it, right? Like, again, the universe is pinging me so many times, I need to somewhat pay attention. And so I went and had my session, and kind of a backstory, I had started my practice on my own. It was a side hustle. At that time, I think I had actually left my other employer. So I was fully employed by myself. We were trying to sell our house. There was just a lot of disruption and instability, right? And my back had been totally killing me. And I mean, I'll be honest, I am not always the best patient. So yeah, I stretched a little bit, but probably not as much as what I would prescribe to a patient, to be honest. And but it always hurt. Like I remember getting like standing up in the morning and it hurt so bad just to stand upright. And I went to this gal, Kathy, and had one session, and she talked to me about how my sacral and root chakras were really constricted and not very vibrant. And yeah, there's a lot of change and da 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 da, right? And so I leave, great, loved it. I felt so peaceful afterwards, slept fantastic that night. I woke up that next morning and I just pop up like zero pain, absolutely zero pain.
Oh,
And I was
wow.
like, well, wait a second, that's kind of interesting. And I'm a very type A analytical person who really likes to put like A plus B equals C, right? Wait a second, we just threw a curveball at you here because everything that I had paid thousands of dollars to go to school for and been teaching people for nearly a decade by this point has totally been changed, right? Not maybe totally, but at least a whole another layer of contributing factors. And so I went back to her and I said, here's my birthday money. Can you teach me? Teach me. So I signed up for her first level class and then I just haven't looked back. And so to integrate that into care now, at the beginning of each treatment, I just kind of hold the intention that I'm going to work to the highest good of the patient during treatment. And if there's any blocks for myself or for the patient, that those be removed so that this session can be as optimal as possible, right? And there's times where I will do some intentions and call upon archangels, and do kind of my Reiki symbols in my head, or even just quickly move my fingers. They might not see what I'm doing, right? But because sometimes when I blend the energy side of it with some people, they're not quite as receptive. So I kind of gauge their openness to those conversations over the course of a series of treatments. And depending on their reaction to when I introduce, like there can be, the way our emotional energy is kind of pent up and our feelings and all that is held in our body. However, they respond to kind of these introductory comments and statements is either opening the door for me to continue that conversation and maybe go into using crystals and grounding techniques and pure Reiki sessions. Or do I keep it very basic and just intention between me and the patient? Because the patient doesn't need to know that I'm working with their energy as long as I have consent, right? Like that's the biggest thing. And so they have consented to treatment by coming into my clinic. And obviously, if we're doing anything internal, there's another layer of consent. And I always ask if it's okay if I touch their body. And then if I haven't quite gotten to the point where I can say, can I work on your energy body, and they know what I'm talking about, or I don't think that they'll quite be there, I'll just ask their higher self and I'll get a yes no question or answer rather. And then I go with whatever that answer is. So if it's a no, then that's no. It's the same as a verbal to me.
Mm-hmm.
But I always want to make sure that that is something that is kind of like I get the nod to work with their energy body
Right.
because they may not be ready for it.
Yeah. And that's the truth with anyone that we come across when we start talking about energy and um, anything with the moon, which you have some great cards. You're going to draw one for us before we leave for the night. And it's just some people cannot release the blocks that society has put on it because it has been such a taboo subject that they're afraid of it and they just can't let go of it. So
Yeah.
if you guys missed the higher self conversation, make sure you go back. I think it was day 3 or 4 with Angela Huber, so you can kind of understand a little bit more of what she means by asking, having that conversation with the higher self and asking about that. Is there anything else you can leave for people watching that you feel would be a benefit to them? Just
Yeah.
whatever.
So I would say, um, if a practitioner, a medical provider of any sort, isn't listening, then move on, find a different provider, right? Um, you can reach out to me. And if you're not in my area, I will do my damnedest to try and help find you someone who I think may be helpful. I can do remote sessions to some degree. Obviously, on the true hands-on physical piece of it, it's a little limited. Um, but I can work with the tissues in even a remote method as well, which is always fun and fascinating. I've had to stretch my mind to be able to do that. But it's fascinating, and the people who have experienced it have been profoundly surprised. So yeah, if you have questions or you want treatment, you can always reach out to me. I'm happy to help try and guide you in your healing journey. Follow me on my private group. Like Jessica said, there is great information. It's been a little bit more higher level stuff lately as I'm on maternity leave, so I've been a little less involved in all the scheduling and details of the posts, but I'm still overseeing everything. Yeah, and um, don't let a provider tell you it's all in your head. I think that's one of my biggest pet peeves because it happens far more than you really think. So fight for your own health. I think that's unfortunate that we have to tell people to do that, but we have put so much trust in our providers. And I get it, rightfully so. But if it doesn't sit well, then find another practitioner and search and maybe reach for those who are doing a little bit of a blended Eastern and Western type medicine. So, yeah.
Thank you. Thank you so much. We'll put the link to the website for Treasure Valley Pelvic Health, and we'll put the link for the group in the comments below so you guys can reach out and ask questions and get the assistance that you need. Just because somebody says, well, that's common or normal, it's not.
No, ma'am. No, ma'am.
All right. Well, thank you. And did you want to share a card with us,
Oh,
with
yeah.
everyone?
Let's
Or?
do.
Yeah.
Let's do.
Let's,
So I found this new deck. I was telling Jessica before we hopped on. It's by Yasmin Boland, Moonology. I don't know if that will be backwards. I think it might be.
yeah.
But it's a beautiful deck and one that I've been eyeing for a while, and I just felt compelled. And I felt like 11:11, it just needed to happen today. So just hold that intention of whatever we need to hear and find. So we have the full moon in Libra, and it's finding balance. These cards are so beautiful, guys. So
That is
beautiful.
gorgeous.
Um, and just for sake of time, I'll just post the comments in below, and you guys can see that instead of having to listen to me just read the thing. But fantastic. And there's even a what did I say earlier? A moon journal that she does, that one of my people that I know who has used her things in the past has said is phenomenal as well. So Yasmin Boland, Moonology, Manifestation. There's a Moonology standard deck and a Moonology manifestation card. So yeah.
Very cool. Thank you. Thank you for
You
drawing
are
a card for
so
us.
welcome.
And thank
Do
you for sharing about your wonderful business journey. You've ventured out on your own and it's going well. You have other practitioners in with you now,
Yes,
correct?
I
Yeah,
do.
Yeah, so a beautiful thing in the Treasure Valley for those of you back in Idaho. And like she said, if you're one of my followers that aren't from Idaho and you need pelvic assistance, then give her a drop a message, right?
Yes. Yes.
Well, I am so thankful for you and I appreciate your time. And we will say good night and let you get some rest since you've got a little one at home.
Yes. Thank you.
All right. Thank you for joining us. Bye,
Bye.
everybody.